A 52-year-old man woke up one morning and couldn't feel his feet. No injury, no accident, just gone. Within 6 months, he was in a wheelchair. The doctor said the signs were there for years. He just didn't know what to look for. Today, I'm going to show you those exact signs, so you never have to live that nightmare. What if I told you that your feet are trying to warn you, right now, about a condition that could take away your ability to walk, run, or even stand on your own? It sounds dramatic, but it's not. Every single day, thousands of people around the world lose feeling in their feet. They start dropping things. They stop walking normally. And eventually, many of them end up disabled. Not because of a sudden accident, but because of something that started silently in their feet years before. That condition is called neuropathy, nerve damage, and it is one of the most underdiagnosed, most misunderstood, and most dangerous conditions affecting people today. Here's the terrifying truth. Over 20 million people in the United States alone have peripheral neuropathy, and a huge percentage of them had warning signs in their feet long before things got serious. Warning signs they ignored, dismissed, or didn't even know to look for. Today, that changes for you. In this video, I'm going to walk you through 9 specific foot pains and symptoms that could mean neuropathy is already developing in your body. Some of these will surprise you, some will make you look down at your feet right now, and at least one of them might just save your life, or at least your ability to walk on your own 2 feet. So if you've ever felt strange sensations in your feet, tingling, burning, numbness, weakness, or pain that just doesn't make sense, you need to watch this entire video. And if you know someone with diabetes, back problems, or anyone over the age of 50, please share this video with them. It could make a life-changing difference. Let's get into it. Sign number 1. Burning sensation in your feet, especially at night. Let's start with one of the most common and most ignored symptoms of neuropathy. Have you ever climbed into bed at night and suddenly felt like your feet were on fire? Not pain exactly, just burning. Like someone wrapped your feet in hot coals. And the strange thing is, your feet look completely normal. No redness, no swelling, nothing visible. But the burning is real, and it's keeping you awake. This is called neuropathic burning, and it is one of the earliest and clearest signs that the nerves in your feet are being damaged. Here's what's happening inside your body. Your peripheral nerves, the ones that carry signals from your feet to your brain, are being damaged or irritated. When nerves get damaged, they don't just go silent, they misfire. They send wrong signals to your brain. And one of the most common wrong signals they send is heat, even when there's no actual heat source. This burning sensation is especially common in people with diabetes. Diabetic neuropathy is the #1 cause. Vitamin B12 deficiency, alcohol abuse, chemotherapy patients, thyroid disorders. Now here's what makes this sign so dangerous. Most people think it's just tired feet, or poor circulation, or they blame their shoes. So they ignore it for months, even years. And by the time they see a doctor, the nerve damage has already progressed significantly. What you should do. If you're experiencing burning feet, especially at night, especially when resting, do not wait. Get your blood sugar tested. Get a B12 test. See a neurologist. The earlier you catch this, the better your chances of stopping the damage. Sign number 2. Pins and needles that don't go away. Everyone has felt that familiar pins and needles sensation. When your foot falls asleep after sitting in a weird position too long, you shift your weight, shake your foot, and within a minute, it's back to normal. But what if that sensation never fully went away? What if you felt that prickling, tingling, electric buzz in your feet, even when you hadn't been sitting? Even when you're lying flat in bed? Even when there's no pressure on your feet at all? That's not your foot falling asleep. That's your nerves misfiring, and it's a major warning sign of neuropathy. In medical terms, this is called paresthesia, abnormal sensations caused by nerve dysfunction. And unlike the harmless pins and needles from a compressed nerve, neuropathic paresthesia is persistent, unpredictable, and progressive. It might come and go at first. You'll notice it one day, then it disappears, and you forget about it. But over time, it becomes more frequent, more intense, and it starts spreading up your ankles, into your lower legs, Why this matters? These tingling sensations are your nerves sending distress signals. They're telling you that communication between your feet and your brain is being disrupted. If left untreated, that communication can break down completely, leading to full numbness. Sign number 3, numbness in toes or feet. This is where things get truly dangerous. Burning and tingling are uncomfortable, but numbness? Numbness is the sign that nerve damage has progressed to a more serious stage. When you can't feel your feet properly, you lose one of your body's most important protective systems, pain sensation. Think about what pain does for you. When you step on a sharp rock, pain makes you lift your foot immediately. When your shoe is rubbing against your heel, pain tells you to adjust before you get a blister. When you touch something too hot, pain protects you from a burn. Now imagine your feet can't feel any of that. People with neuropathic numbness develop wounds, cuts, blisters, and infections, and they don't even know it. They walk on injured feet for days. The wounds get worse, they get infected, and in severe cases, especially in diabetic patients, those infections can lead to gangrene and amputation. This is not an exaggeration. Every 30 seconds, somewhere in the world, a lower limb is amputated due to diabetic complications, and neuropathy is a leading factor. The progression looks like this. Stage 1, occasional tingling and burning. Stage 2, persistent tingling, early numbness. Stage 3, significant numbness, pain. Episodes. Stage 4, loss of most sensation. Stage 5, complete numbness, total nerve failure. If you're experiencing numbness in your toes or feet, even mild numbness, you are likely already at stage 2 or beyond. Please do not wait. Sign number 4, sharp, stabbing, or electric shock pain. This one is confusing because people often think nerve pain means dull, chronic pain, but neuropathy can also cause sudden, intense, sharp pain that comes out of nowhere. You might be walking normally and suddenly feel a stabbing pain shoot through your foot, or a jolt of electricity that makes you flinch or cry out, or a deep, aching pain that feels like your bones are being squeezed. These random pain episodes are called neuropathic pain attacks, and they're caused by damaged nerves sending random, chaotic pain signals to the brain. What makes this especially disorienting is the unpredictability. The pain can hit when you're walking, when you're resting, when you're sleeping. There's no pattern, no warning, and it can range from mildly uncomfortable to absolutely debilitating. Many people who experience this go to the ER thinking they have a fracture or a severe injury, only to find nothing wrong structurally. The problem isn't in the bone or the muscle, it's in the nerve. Sign number 5, sensitivity to touch, allodynia, 300 words. Here's a sign that almost nobody talks about, but it's incredibly telling. Do your feet feel painful when touched lightly? Does even a bedsheet touching your feet at night cause discomfort or pain? Does a gentle breeze on your feet feel irritating or even painful? This condition is called allodynia, where normal, non-painful stimuli become painful due to nerve dysfunction. It's the opposite of numbness. Instead of feeling nothing, the nerves become hypersensitive and overreact to even the lightest touch. For people with allodynia-type neuropathy, even wearing socks can be unbearable. The seam on a sock feels like a razor blade. A light foot massage feels like torture. Walking barefoot on carpet is agonizing. This hypersensitivity is just as serious as numbness. It's a clear sign that the nervous system is severely dysregulated. Sign number 6, weakness in feet or difficulty. Walking neuropathy doesn't only damage sensory nerves, the ones that help you feel. It can also damage motor nerves, the ones that control your muscles. When motor nerves in your feet are affected, you'll notice difficulty lifting the front part of your foot while walking, called foot drop, stumbling or tripping more than usual, feeling like your feet are heavy or uncoordinated, difficulty standing on your toes or heels, muscle cramps in your feet and calves. Foot drop is particularly dangerous. It causes people to drag their feet when walking, dramatically increasing the risk of falls. And falls in older adults are one of the leading causes of serious injury and disability. If you've noticed changes in the way you walk, if your gait feels different, if you're tripping more, if stairs feel harder, your motor nerves may already be involved. Sign number 7. Balance problems and frequent falls. 300 words. Your feet don't just move you around, they also tell your brain where you are in space. This sense is called proprioception, your body's ability to sense its own position and movement. Neuropathy disrupts proprioception. When the nerves in your feet can't accurately report ground contact, pressure, and position to your brain, your balance suffers dramatically. You might notice feeling unsteady when standing with eyes closed, wobbling on uneven surfaces, needing to grab walls or furniture more often, feeling dizzy or off balance when walking in the dark. This is why neuropathy patients have a significantly higher fall risk, and falls can mean broken hips, head injuries, and a rapid decline in independence. Sign number 8. Wounds that won't heal. Here's a sign that moves neuropathy from uncomfortable condition into life-threatening emergency territory. When the nerves in your feet are damaged, two dangerous things happen simultaneously. First, you can't feel injuries. You step on something, get a blister from your shoes, or develop a small cut, and you don't notice because you can't feel it. Second, neuropathy often occurs alongside poor circulation, especially in diabetics, which means even when you do notice an injury, your body can't heal it properly. Blood flow to the feet is reduced. White blood cells can't reach the wound efficiently. Healing slows to a crawl. The result? Small wounds become chronic ulcers. Ulcers get infected. Infections spread to the bone. And in severe cases, the only solution is amputation. Check your feet daily. Look between your toes. Look at your heels. Look at the soles. If you find a wound you don't remember getting, or a wound that's been there for more than 2 weeks without significant healing, seek medical attention immediately. Sign number 9. Changes in foot shape or skin/nail appearance. This final sign is one of the most overlooked because it seems purely cosmetic. But changes in the physical appearance of your feet can be a direct result of long-term nerve damage. Look for hammer toes or claw toes, toes that curl downward due to muscle imbalance caused by motor nerve damage. Charcot foot, a serious condition where the bones in the foot weaken and collapse due to lost sensation and repeated unnoticed trauma. Dry, cracked skin. Autonomic nerve damage disrupts sweat glands, leaving skin dry and prone to cracking. Thickened or discolored nails. Poor circulation and nerve damage affect nail growth. Muscle wasting. The small muscles of the foot shrink due to motor nerve damage, changing the foot's shape. These physical changes are signs that neuropathy has been present and progressing, often for years. What causes neuropathy? 200 words. Now that you know the signs, let's talk about why this happens. Diabetes. Number 1 cause worldwide. High blood sugar slowly destroys nerve fibers. Vitamin deficiencies, especially B1, B6, B12, and E. Alcohol abuse, toxic to nerve tissue. Autoimmune diseases, lupus, rheumatoid arthritis, Guillain-Barré syndrome, infections, Lyme disease, shingles, HIV chemotherapy. Many cancer drugs are neurotoxic, kidney disease, thyroid disorders, genetic conditions. Unknown cause, idiopathic. In about 30% of cases, what you can do right now. Here's the good news. Caught early, neuropathy can be slowed, managed, and in some cases reversed. Here's your action plan. See your doctor, request a full neurological exam, blood sugar test, B12 level, and thyroid panel control blood sugar. If diabetic, tight glucose control is the most powerful tool. Check your B12 crease. Deficiency is incredibly common and easy to fix. Reduce alcohol. Even moderate reduction helps nerve recovery. Exercise regularly. Improves circulation and supports nerve health. Inspect your feet daily. Catch wounds before they become ulcers. Wear proper footwear. Protective shoes reduce injury risk dramatically. Ask about medications. Gabapentin, pregabalin, and certain antidepressants can reduce neuropathic pain. Your feet carry you through every moment of your life. They deserve your attention. If you recognized even one of these 9 signs in yourself or someone you love, please don't wait. Don't dismiss it as just getting older or just tired feet, because neuropathy doesn't stop on its own. It progresses, And the longer you wait, the harder it is to treat. Share this video with your family, with your friends who have diabetes, with anyone over 50 in your life. And if this video helped you, hit that like button, subscribe for more life-saving health content, and drop a comment below. Tell me which sign surprised you the most. Take care of your feet, because your feet take care of you.